It needs to be, thank you. Now, heart disease and stroke are the world's biggest killers, and millions of people in Britain take cholesterol-lowering drugs to reduce their risk.
Now, scientists have revealed they've begun human trials of a vaccine which could offer patients an alternative to taking daily medication. Let's get a bit more detail now from Sir Nilesh Samani, Medical Director of the British Heart Foundation. Morning to you. Thanks very much for joining us. Just give us a sense, first of all, if you would, how big a problem cholesterol is here for people in the UK.
It's a big problem. Cholesterol is one of the main risk factors we have for coronary heart disease. Other things, smoking, diabetes and hypertension also play an important factor, but cholesterol is really important. And lowering cholesterol is really a key to reducing the risk of getting coronary heart disease and heart attacks.
Right, so now they've discovered that they might possibly have a vaccine. How significant is it?
So, I'm sure your viewers know that we have drugs for lowering cholesterol. So statins are the most commonly used drugs, but there are others. But these drugs need to be taken on a daily basis. And therefore, particularly for trying to prevent diseases, compliance is an important issue. So this vaccine, you have a vaccine given to you, and that removes a molecule in your blood which prevents the liver from taking up cholesterol. And so by just giving a single injection and perhaps a booster every year, you have a permanent reduction in your cholesterol level. So the importance about this research is that it may provide a treatment that is much more patient-friendly.
You talked about compliance. So what you mean, as far as I understand, is people just don't take the medicine necessarily.
That's right. I mean, if people are being given tablets for treating, say, if you've got chest infection, you take antibiotics, you do take them. But if you have to take a drug on a long-term basis for reducing your cholesterol to reduce your risk of heart attacks, that's, preventive treatment for prevention is, compliance and not taking tablets is quite an issue.
How soon might this actually be available, do you think?
So the studies that have been reported just now, the findings show that in animal models, that giving this vaccine reduces the cholesterol level as expected and also reduces the furring up in the artery of the heart. So it's an important step in terms of demonstrating the benefits of this approach. There's clinical trials have been started to see if the vaccine actually works in human beings and lowers the level of this molecule in the blood first and then lowers cholesterol. But it will take a little bit longer, of course, to then demonstrate its safety and efficacy. So we are still talking about some time, several years.
And what about the causes of cholesterol? Do you think they're sort of misunderstood by the public? Because some people assume it might be to do with being overweight or perhaps being inactive, but it's not just that, is it?
No, it isn't. I think it's a very important point that people assume that all our cholesterol comes from our diet, but that's not the case. Our body makes cholesterol, in particular our liver makes cholesterol, and people can eat a very healthy diet and still have a high cholesterol level partly because of the genes they've inherited. So one shouldn't assume that an elevated cholesterol is only due to a bad lifestyle, and that's one of the important reasons that particularly developing treatments for lowering cholesterol is so important.
Okay, Dr. Nilesh Samani, thanks for your time this morning at breakfast. Thank you.